Like on 91.3, of course, on the Savannah Connect show, and the team is set in the studio, and of course, some of the sketches for the main discussion. So we set, and like I said, the two strong women in the region are poised for action, and of course, they are delivering to your very best as far as COVID-19 is concerned within the northern region. And of course, we are looking at maternal health care and some economic challenges in fighting COVID-19. To join us in the studio this morning, we are privileged to have Haja Lima Said Sagito and Nadia Ali to talk more on this issue and to see how this will benefit women generally. Good morning to you, ladies, and thanks for joining us.
Good morning.
Good morning. Let me start with Hajia first because she's the mother of the region. Yeah, Hajia. It's obvious that you would start the conversation. First of all, let's look at the issue of COVID-19 here in the region and some challenges as far as maternal health care is concerned.
Yes, thank you very much, and good morning to our cherished listeners, and also for the opportunity given us by the GBC-RADIO Savannah, as usual, to come and also add our voice. Yes, we are all in a challenging moment, like the President of the Republic of Ghana said. We are not in good times. We are not in good times, and things. Therefore, we should all see ourselves as having been part of the process of making the positive change that we are all trying to look out for. Now, coming to northern region, I know that we are part of Ghana, so everything that happens in Ghana affects us. And also the fact that if you look at our location has a lot of disadvantages as well. And then we have more challenges when it comes to some other issues, especially health implications. If you want to even look at it from facility level, you want to look at it from personnel, you want to look at it from equipment. So that gives us opportunity to be very, very aggressive when it comes to COVID-19 in terms of discussing it, so that we get it very, very far away from us. Unfortunately, we are faced with the challenge that we've also recorded some. But it's fortunate. The fortunate part of it is that so that we as people in the north know that it is very rare. It is not like it's very far away from us. We are living with the reality that as a region, no matter what we do, we've also be able to unfortunately record some. So it gives us an idea that we need to be very cautious and personalize it, because you don't know who has it as we are living now. Now that is just on another side. The other side about what we are discussing for northern region is the fact that we are very traditional in terms of the way we live. So therefore, sometimes when you don't have, they say experience is the best teacher. Now that we are experiencing some, and basically almost like living with some, even though they are in isolation, it gives us room to be able to protect ourselves and go by the protocols that the authorities have put in place for all of us to be able to observe. It is rare. For me, it is a very rare, it's a reality now that we must face.
Okay.
And we must work towards, as much as possible, avoiding ourselves from being coming in contact with it. Because for me, if you personalize it, it's what they call an individual fight, but you do it for the good of the society. Because if you are off it, it means that your family is off it, the society you live in it is off it. It is a reality and we must face it. And what is good is that for me, a lot of information has gone on. Almost everybody now talks COVID. Even our rural communities, where even though they have information, that may not be a lot of to the level that we want, but there is some level of awareness on it, that the disease is real and everybody is ready to support the process of preventing it.
Okay. Thank you very much. You can also, Adia, you can also join us on Facebook live on GBC Radio Savannah on 91.3. So wherever you're monitoring us from, you can also send us your message, your thoughts, suggestions as far as the issue of COVID-19 relating to maternal health care in the region is concerned. So once again, we are live on Facebook and it's GBC Radio Savannah on 91.3. So send your messages coming in this morning. Let me come to you, Nadia. Let's look at women, maternal healthcare women, as far as COVID-19 is concerned. What has been your observation?
Good morning to our cherished listeners. We are here as usual to discuss the issues of COVID-19. That has been, every time we wake up in the whole world, it is the general pandemic. That is the thing that wakes you up and takes us to sleep globally. So as women, we have faced with lots of challenges. There are some positives that some women feel, some positives of saying certain lockdown has brought their husbands home. It's building positive relationship. Children have access to their fathers, and then despite that, we still have certain issues of domestic violence rising up. From a report I read from the UN Population Fund, they said that some few challenges with COVID-19 are the women will not have very good access to sexual and reproductive health services, because the frontliners, the health workers also are at risk. They have moved their positions to various stands where they have to serve as frontliners. So access to such services are not available. When we come to our financial status, already it's recorded global that women have a very low financial status within the world, bringing down to sub-Saharan Africa and coming down to our northern region. It is even lower there, and this is going to woefully affect us. I think yesterday on France 24, I learned the poverty is moving since 1931. The world poverty is going to 30% globally. Where is this leading us to? Where are women getting into this position? What percentage are we giving to women at these figures? So, and again, the same women are losing services to the health facilities. You hear doctors are not at post, doctors are busy, they are not able to provide certain key basic necessities, health services to us as women. So it makes us women feel more vulnerable. It makes the women feel, the issue, we have healthcare services that is free, like the health insurance services available, but when you go and they can't access this, they will then go back to the traditional settings. Which in another way, it's another whole complication
on its
own that we have to start again. So in general, we are really afraid of the challenges and the circumstances we'll be facing as a world and as women from now.
Okay, so is it possible that this challenge, we can have a remedy to this challenge as far as this whole pandemic is concerned?
This is a global issue.
Okay.
And the World Health Organization is up, Global International Women Organization are up, trying to see how we can sort this as a global remedy. I think for northern region, I heard some of the hospitals being innovatively, the sub-clinics, the community hospitals, the CHIPS compound, in order to save their health staff from also being contacted, losing their services. Some of them have decided to reschedule. They have their normal schedule. Some go for morning, afternoon, night. They have decided to divide themselves into a number of shifts. This group goes for this period, maybe 2 weeks. Then this group comes for 2 weeks. So this also comes for 2 weeks. In that case, we are sure of the health and safety of our healthcare providers, then we are sure of certain minimum services available for everybody. So this is what I know some of them are doing as at now. But for the other ones, Aja, do you have any other?
Okay, let me come to
Yes,
Ajia
yes.
with the issue of culture and tradition, and pregnant women actually adhering to these safety precautions in safeguarding themselves from COVID-19 in the region.
What a question. Yeah, your concern is very genuine, and I think that is something that we really must be discussing as we move on in the fight against COVID-19. We cannot put on hold issues of maternal issue because women will always get pregnant, women will give birth.
And under the men are staying in the house more. You never can tell what will happen.
To each of us.
Each of us. Okay.
Yeah, so it is worth discussing actually. So, like you said, there are issues of tradition and there are issues of decision making when it comes to assessing services that she mentioned as a household because of the culture and the traditions that we are coming from, where a lot of decision making has even sometimes going to access health facilities, somebody must give you go ahead. Given the fact that we as women, and a lot of the challenges because a lot of us have not got money by ourselves, so you may have to depend on your husbands or other relatives to do. So if you don't get the go ahead, it's a problem. And now bringing that to the decision of the COVID, that's why we are saying that you have to personalize it. This if we, as much as possible, we are educating women, make it a personal responsibility to be safe from it. It is true that because staying at home, being cautious, using a lot of the protocols, washing your hands, and then protecting your face and then making sure that your hands, those are personal things that you may not need a decision from somebody to tell you to do. You see, so the culture is there. The culture becomes very relevant if it has to do probably with going out to assess where you have to pay, and then you may have to look for decision from someone to back you to do that. But when it comes to the COVID-19 and the protocols that will make you safe, those are very personal things that as a woman you may have to do it, and also encourage your children to do it. You get it. So like I also wanted to add to what she said about the effects. So sometimes there's a lot of now self-medication, which is something that we may also have to now look at it, because and that one affects women more. You see, a lot of the women are staying with their children, so the tendency for self-medication is very high. It is very high. Even besides that, a lot of them, sometimes the way we work, a lot of the women already take more painkillers just to be able to withstand, feel okay, to be able to continue their daily activities. So we see the tendency for it to increase. The pressure of talking, the pressure of every time before the day ends, you are already exhausted, and then you may just think that you should get something to relieve you. And you see, the sometimes as women we are not able to, our level of information. Sometimes you are even at home doing other things, that information is flowing and it will just bypass you. You don't know what is happening. So all those things are things that we must be very careful as to how we go around it when it comes to medication. If not, the COVID will be over and will be generating other issues that will be bigger for us to be able to handle, especially as women. And we need these women to be able to be there every day, because if we don't get these women there, the problem will be said that we cannot handle. Yes, we need women healthy.
Okay, Ajia, looking at your submission, I think from the urban perspective, whatever you have said is well sorted out. The urban woman is able to pick her own information and probably get closer to the news and get informed. Let's look at the rural perspective, where our rural mothers don't even know what's happening. Probably it is the men that will give the information, and if they don't give, what happens? Looking at it from a complication angle.
It is really true. Probably my sister will add up as You see, my issue of the self-medication, I was
Okay.
even looking at it from that level of the rural setting,
Okay.
where there's already a lot of, you don't have a lot of services being provided there already. So the women already, a lot of them already in self-medication as an option. Now it's going to increase. That is my thing. But coming to the education at the rural level, a lot of the situation we have that challenge of women don't have, even the radio is there, but they don't have it. And even they have it, their household chores is such that the information will pass. And a lot of the women depend on their children for information. Their children go out and bring information to them. And then some men too are able to give. So if you have a man that is in the house and is able to help you with some information, and that is really an issue that we really need to look at. That I'll be talking to my team, and then in the groups that we work with in the communities, every small information we have, we're able to get our contact person to be able to deliver it to them. That is the only way we can all do to make sure they are getting the right information. In this fight, the quality and the quantity of information matter.
Okay.
Very much.
The quality
and
of the both matter in this case, and the frequency of the information. You get it?
Okay.
We should not be giving so much gap in giving out the information. Because when there's a gap, people will fill the gap. And a lot of the issues time when people are filling gaps, they give you information that people like good information that sometimes you think that is good for you, even though it could be lies. But for as far as it's good for you, you want to work with that one. We don't want to be able to create that gap. That gap can be very dangerous as far as our rural setting is concerned. So for me, whatever we all have to do to make sure that those of us who work in communities, even though currently there is even though we've not been locked down, but by our own personal decisions, we have limited movement. So, but we have people on the ground that we use our volunteers. We should be giving them a lot of good information.
Okay.
At the right time, so that they can, and be encouraging them to be sharing those information using any means possible, so that we can get the women informed. When the women are informed, because they stay with the children, they can be able to get the children practice the best behaviors that we are looking for, and then we'll be cutting down the spread, and all of us will be safe. For me, that is one way that we can handle it, in addition to the radio discussions that go on. So I want to encourage a lot of us already. That's what this time nobody does a lot of discussion apart from COVID-19. So we should continue like that and make sure that the message is being delivered in all the languages that matter, so that more people will hear it directly from the experts. It's also important that they hear it directly from the experts. And the message, the way we are delivering it, should be convincing enough. Because sometimes people doubt. You give the message and somebody reads it and says, what is this? He's not feeling the message. He's not able to associate with the message. So we need to be able to be personalizing the message and let people see themselves in the messages we are delivering. When you see it that way, then behavior change becomes easy. But if you let people see the issue very far from where she is, she can't relate with it, so then she will not change. That's why we're wasting our time. And I think that we've gone beyond wasting time. Now we need to do effective targeting. We need to target well, deliver at the time we need to deliver. Make sure that there is no space for anybody to fill in with wrong information.
Let me come to you, Nadia.
Adia has almost exhausted all the key points, but I think while she was speaking, I got some other. So, for instance, on Friday last week, I was watching Sagani TV, right? There was a preacher on air preaching. And he's one of the popular ones. Most of these are rural women listen to with their radio phones. And he really made a good submission on the need for lockdown and avoiding public places like praying in the mosque.
So I was telling my husband, I said, this is a very good platform we could use to really get down to our women in the communities, because there is a very good statistics that shows that they really listen to his preachers on Fridays. Is it Afa Mutada? Yes, the women really follow his preachers.
Okay.
So, and he really gave a very good quoting with religious backing. So like I just said, the word should be what do I say? It's direct from a source, a very good convincing. So yes, we seem to be more religious within our settings. So if somebody like this, who is a spiritual leader, coming to say, do this, the prophet said this, God said this, you will be rewarded for it.
Okay.
I think that is one very good channel. I really applauded that day. Then again, as community workers in the communities, like she said, using the local languages. So for us, we have done jingles within the districts, the Nanumba South, which they play at funerals, on a van. They take it around the communities. So for this, whoever you are, wherever you are, there will be a listening. So using our community volunteers as well, like I just said, the source should come from a reliable, the information should be from a reliable source. So the volunteers doing house to house women, to the women, whilst talking to women on malaria and households on the preventive measures. So everybody gets the information, so which is direct in contact. So in addition to what Ajia said, I think whilst we are doing this, our rural women will have this information as well to prepare and guide the children. I think children really listen to our mothers more, and now that they are home, getting closer to their mothers, together, running their chores and other things, it is a very good time. We need to get the mothers to have the information on their fingertips. It should be something like the child should always know, before I eat, I need to wash my hand. If it hasn't been a practice, it should be a practice now. Don't be going to crowded places. I hope for now this issue of night, those who do the video shows has ended. Because those are places we have.
I'm not sure about the video shows, but our children are still on the streets. I mean, you go to places and you see them together, they are holding each other and doing their own thing. So I get a bit alarmed when I see them like that.
Yeah,
I don't
it's
know.
really alarming, because I read the Ghana statistics, the COVID rate for young people between 15 to 24. I saw a statistic that shows it has a higher number within the suspected cases and all those things. So it is really another target. We should really look at the young people within our sector, how we can. So, but all in all, if the mothers have the first-hand information, she knows what COVID is, how to prevent it, what do you do to stay away, then she'll be able to educate her children and then we need the support of our fathers as well. We are not talking of only the mothers, but as a household, as a country, as a world. I mean, why would Adia leave her home? It's raining in Tamale now, but she had sacrificed and said, Nadia, I'm here, come and join me do this. I mean, who am I to stay indoors? It is something that is keeping her awake. She can't sleep because of all these things. And for Ghana, I mean, our statistics looks a bit calming. But when you wake up and look at the Italy, you look at US, you look at, I mean, it is really heartbreaking. We just have to put all our efforts together and then kick this thing out. I know in Liberia, the president himself is the team leader, right? He is really out trying to get his people out. So using music as a source. So probably he has looked at what do my people want more. Then he has brought himself as the leader to sing, to bring his people together. And hope it's working well. And other places like Kenya, where the people are refusing the lockdown, they are bringing the messiahs to really discipline them on this. Yeah, so all strategies that the world is using. I mean, this one, we put the issue of abuses down, put domestic violence, certain violence and other human rights issues down to fight the COVID. Is there anything more than this COVID? Any human rights abuse more than this COVID? We need to protect our own lives. You don't need somebody to protect your life for you.
Aja, Nadia just brought my next question up in terms of strategizing in Ghana as far as COVID-19 is concerned, you are within the affairs of the presidency. Let me put it that way.
Yes.
So for now, are we on course in terms of strategies in curbing COVID-19 in Ghana?
Thank you. I don't know which level you put me. Very high level. A level of decision making. That's
sure.
okay. It's good. I like it.
Okay.
Yes. Yeah, I think that your question is also important. For me, from where I stand, I think that the best we can do is what we are doing now.
Okay.
Even though we still can do more. But the best is what is happening. Like our president said, we cannot always report. Our circumstances are different. Our circumstances are different. The dynamics are not the same. Even though someone will say they are similar, but they are not the same. They are similar, but they are not the same. So within the context that we have as a country, and the dynamics that we all face is what the president, with the advice of the team that he has and the ministers, they'll be able to put. And for me, studying each of the protocols that have, if we all go by it, I think that we will be very, very safe.
Okay.
And we'll be able to push, we'll be able to manage what we have now, get all of them well, God willing, get them into, and then we will be declared COVID-free Ghana. It's very possible. But the issue too has to do with, as individuals, we need to be very passionate about making sure that the protocols are followed.
Okay.
Leaders will always make rules, but the implementation of the rule, we have to take the responsibilities for it. You have officers responsible, they are doing. How are we individuals interpreting what the officers are doing? Are we interpreting it to support the action, or we are interpreting it to demoralize people?
Sure.
You see the thing. A lot of the way we interpret the policies does not encourage even the officers to be able to enforce. So at a stage they lose, they give up. Yesterday my brother called me from Accra and said, "Oh, Aja, 4 days when they started the lockouts, it was really working. We're very proud of our president."
Okay.
Then all of a sudden that people are now just going now. Then I said, why? Now the security, you are going, they are just looking at you, because I said, so what happened? Then he again said that probably it's because of the too much complaints. You get it? Too much complaints. The military is doing this, the police is doing this, the task force is doing this, and nobody wants to lose their job. You want to protect people, but your job is also important. Can we just stop too much of complaint and allow the systems to work to some stage? Then they review. We don't say that people will not make mistakes, but is one mistake enough for us to use to generalize and disorganize a system that has been said to protect all of us? Is it enough? 1, 2 mistakes, is it enough that people make? In our own households, we make rules, people break the rules. You can make rule in your household. Somebody will intentionally test the rule. So if as a parent you want to enforce it, does it make you a bad parent?
No.
So we need to look at these things and make sure that we are just going by the protocol. If we are all obeying the protocols and it is not working, then we can review. But we are just sometimes not just in position to just obey. All we want to do is just to work. So we should allow the systems to work. When the systems work, we will definitely make changes.
Okay, so let me come back to Nadia on the issue of fear and panic as women who are expecting and they are carrying. You know, when you go to some antenatal, they tell you to relax and be calm and do things that will not raise your anxiety. In this period, what would you tell women who are expecting to become wherever they are?
So it's a period where we are all not resting with our pregnant women.
Okay.
I had to call my brother and was like, which month is she expecting? He says it's in April. I told him, please let her hold on the labor till after April.
Oh, really?
I mean, I have gone through it.
Yes.
Because I'm looking at where will we do the delivery?
Okay.
TTH, is it going to be normal? Is she going to go through CS? So if it's a normal thing, then within our rural settings, they will still depend on the TBAs at home to avoid a certain risk factor. Because in cases of where there are lockdowns, for northern region we are not under lockdown, but for southern sector Asia, imagine distance where they have to travel. So the work of the TBAs is now coming back to our communities. Very well, and we are hoping that they still have enough skills as TBS, or we've not abandoned their services all this while. These are times where we really need their support, because you feel, for instance, hospitals where we have people being kept at quarantine. Please, you and I will not want to go there.
No. Sure.
Yes. I mean, you and I will not want to go there. Even if I'm pregnant today and I have to go to TTH in Tamale, please.
You will not go
I
there.
prefer to go to St. Lucie at Clancy here. No, it is a human thing.
Sure.
That's personal.
And yesterday I was at TTH personally.
Yes.
I just didn't like the environment because
Good.
it used to be a very busy place,
So
and the whole
it
place was so
was so
dry
dry,
and quiet.
and those things.
I said, wow,
I
what's
had
happening?
headache. I had to go to Hajj Kadri's clinic.
Wow.
To avoid one or two things. I could call doctors at TTH, West Hospital, Central Hospital. But just the mere fact that they said
you don't want any trouble.
So imagine a rural woman, what will she do in this case? For all you know, she will even deliver without a TBA at home. I shipped to the Blanchana. They said Sobelan Kwanda, Sobelan Tinda. So I mean, when they have this misconception and misinformation down there, certainly our healthcare, sure, yes, we are just hoping we have normal deliveries, safe and normal life births with the TBAs. Or else a lot, like I just said, instead of curbing this, we will be regenerating a lot of new ones. I just want to touch briefly on the support government is giving women. We know he's trying so much to keep people going, businesses running, to support them. Most big businesses we hear in Accra have gone down to producing nose masks, sanitizers, supplying foods and other things. Yes, and we know the government has empowered other channels like the MBSSI to come down with support for women to move, I mean, just to boost their businesses. And for now, I know there has been very low importing into the country, and we want to emphasize on that. I mean, to increase our poverty levels. To reduce our poverty level and increase employment in the country. I know some of these efforts now has really increased jobs for young people, because we are, I mean, recycling our own thing, producing our own things locally. Haja, this will go a long way to support and to also boost our economy as a country in the faces of the world. I mean, we have the talent, we have the skills, we have the labor, we have certain amount of raw materials. If not 100%, we have about 80% raw materials to be able to produce our things. How come today Kasapreko is producing hand sanitizers, rubbing alcohol, clinics, laboratories? TTH is producing. So what were we doing all this while? And we were importing these things.
And it's now.
I mean, NGOs have started producing hand-sewn hand masks. And I know with this nose mask, after doing it, when you go through the UN approved methods, you go through it. At the end of the day, you need to put it in salt solution as a disinfectant to dry it. Then we are using, which is 70% protective. I mean, let's assume our cases in the northern region is low, so the 70% protection should be enough for us, rather than the misconception about certain masks that are coming in. People are not aware, like afraid of using them, and all this as well. So we really appreciate and applaud the government support,
Okay.
But we need them to do more. I mean,
Oliver Twist.
Oliver Twist. No, we need more. The government himself knows that it's not enough.
Okay.
Yes. It's yesterday I was asking somebody, what is our business development ministry doing? We've not heard anything so far. We've heard the MBSSI is doing this. NGO coalitions are doing this.
Okay.
This is doing this. But they are the backbone.
They are preparing.
They are preparing.
They are preparing.
We hope they are preparing.
Okay.
Yes. So before I conclude,
No, don't conclude. Let's
Don't
add.
conclude.
You know
I'll
what she's
conclude.
saying about the
Okay.
businesses. You know, we want to just say that we would like to plead that there should be proper focusing and targeting of women when it comes to accessing the loans.
Okay.
Because the women are those who do most of the businesses. We are a lot in terms of figure. We are more in the informal sector.
Okay.
And if you look at this economy, the economy is probably run by the informal sector more. So if we get more women businesses boosted up with capital, and they are going to go through the real terms that the moratorium and then the long-term payment, at least medium-term payment schedule. I think that it will transform a lot of women, and then we'll get a lot more women able to come out of poverty, and their income level will increase because our incomes are really low, really low, and with income and boost, I think that we'll be able to transform that.
Okay.
I
Nadia,
think
let me
the
come to
amount
you.
should also be something substantial.
Yeah.
I mean, the women have gone past these 200, 300 CDs
Okay.
at this level.
So it depends on the woman you are dealing with.
Yes, but for some, I mean, they shouldn't generalize it.
It's not you enough capital.
Yeah, so we should
Your
look at
last words.
the level.
Don't
Nadia.
allow
and
one
then-
person to go and take money that could
On
have
behalf
We
helped.
will not do that. They should be able to do. I mean, the
Yes,
officers should be able to do the categorization
Okay. Your
very
concluding
well.
remarks, Nadia. Finally.
I'm not concluding. We need to touch on the rains have started and then malaria.
Your time is up. The time is up. We need
The
to
rains
wrap
have
up.
started and then malaria has started. We'll start showing its signs and phases around,
Okay.
which has similar temperature. COVID has high temperature.
Okay.
The restlessness. Some goes with cough and other fevers. Yes. So we just want to urge everybody, if you have these signs, please do the test.
Okay.
Go for the test. Don't feel it is COVID or somebody will say it is COVID because we know
So
stigmatization is going around and it's a very big thing that won't let people come out. Let's not do the self-medication.
Okay.
Let's go for the test and then confirm, yes, it is malaria, then you'll be treated.
Okay.
Or else...
Yeah.
Thank you. Haja.
Thank you very much. Like she said, we are in malaria season. This is a season for malaria, and we must talk about malaria. Malaria is seriously killing people as well, and we also would like, as much as possible, people should be conscious of it. If you see the protocols, a lot of it also, if you do it well, personal hygiene, keeping your environment clean, all those things will help you prevent malaria. And malaria reduces people's income a lot. It takes a lot of productivity away. I mean, if one person in your house is sick of malaria, it's not an easy thing. Sometimes the woman can no more go to work. If you're in a community level, people have to leave community and be visiting you if you're on admission. So it is a very big issue for us. And we think that because the signs are this, almost some of the signs are like the COVID signs, we don't want to reach them. Let's, as much as possible, make sure that this season of malaria, we are very far from it. Because of the fact that you don't want them to take your sample and go and be tested for COVID.
You better
Seek early treatment and make sure that your malaria does not grow into a stage where they are suspecting you. Please. Thank you
very much, Haja. On this note, we'd like to say a very big thank you to Haja Alima Said Sagitu and Nadia Ali for joining us in the studio this morning to talk about maternal health care and some economic challenges in fighting COVID-19 in the region. So stick and stay. Up next, we are hoping to have the MC for Sanargu in the studio, and of course we'll be looking at the role of the municipality in fighting COVID-19 and some interventions being made so far. So stick and stay with us. We'll be right back.
No, Maria is coming.
Yeah, that's what we are hoping.